So, Laura Godfrey-Isaacs is presenting today, and she's sharing the work that herself and Jessica Falk-Perlman have been working on. Laura is an artist, a midwife, a writer, and a creative producer, as well as chairing Shifrah UK, the UK Jewish Birth Association. Laura produces the award-winning global community movement Maternal Journal, which supports maternal mental health through creative journaling. It is with great pleasure that I hand over to Laura to talk about how we move towards Jewish cultural safety in maternity care.
Thank
Welcome,
you
Laura,
so
and
much.
thank you.
Thank you so much, Ali, and everybody. It's lovely to have you in the room. Happy International Day of the Midwife to all of us. It's a special day, so it's lovely to be here from London. It's 8 a.m. in London. I'm not sure what time it is where you are, but I hope you have had time for a coffee or something to eat and you're feeling ready for this session. Unfortunately, my colleague Jessica was not able to join us. She's on a clinical shift, but as Ali was saying, we've produced this work together, so I'm going to represent that today. So what we're going to look at today, so why Jewish cultural safety? So we're going to particularly look at some key messages from a very important report the NHS Race and Health Observatory produced at the end of 2024, and there are some sort of really key messages we're going to use to open up this discussion today. I'm going to try and introduce to you what are Jewish communities, what are Jewish identities, so that I'm hopefully increasing understanding and awareness of our diverse culture. I'm also going to look at some key tropes and the impact of anti-Semitism in healthcare. And then I'm going to talk about some specific Jewish birth practices, so that hopefully if you are either educating midwives or you're a midwife yourself working in clinical practice, you'll be better equipped to look after Jewish birthing people and that you'll be able to provide safe care for them. So that report that I mentioned, this is just to flag it up to you. And one of the sort of really quite impactful statements that came out of this was from the chief executive of the NHS Race and Health Observatory, who do much really important research, particularly into minority communities in the UK and birth and health inequalities. So this saying Jewish communities in England have often been neglected and overlooked in conversations about health inequality. And that's why I was really happy to have this opportunity to come and talk to you guys at this conference, particularly because it's such an international scope, to really try to raise this issue within the wider work that we're all doing, hopefully, to provide safe and excellent care for all the people that we look after. So some of the key recommendations that we can look at from this report, which I think really open up some of the issues, they really highlight the need for workforce education, and that's hopefully what's happening today. So they really suggest that there's a lack of understanding about the Jewish community, and there are lots of assumptions and stereotypes that people hold, and this is a barrier to people understanding how to best look after this community. Another important issue is to improve patient data records. So it's not always understood by people that Jewish identity is not just a religion, it's an ethnicity. On our data form, particularly in the UK, in the NHS, there is not actually a category for your Jewish ethnicity. There's often a place where you can tick Judaism as your religion. But as I'll go on to explain, many Jewish people are ethnically Jewish. They may be culturally very connected to their heritage, but they don't actually practice. They're not observant. But that doesn't mean that they're not Jewish. So this slightly complex idea about Jewish identity being an ethnicity and a religion is not reflected in the data collection, particularly in the UK. And that is really a barrier to us understanding what's happening with this community. Another important issue that was highlighted was the trauma-informed care. Now, that's something we talk about quite a lot in maternity, but it's not understood perhaps that Jewish people might be holding particular types of trauma. So, for example, in a family where you might have contact with parents, grandparents, there might actually be first-hand experience of trauma. There might still be, victims of the Holocaust that are carrying that kind of trauma. And also there is a concept of intergenerational trauma. So a lot of people in the Jewish community, they might be, for example, children of Holocaust survivors, and this intergenerational trauma is passed down through the generations. Also, because of the rise in anti-Semitism at the moment, quite a lot of Jewish people are feeling that is kind of triggering their intergenerational trauma, and they're also often feeling afraid and unsafe in many public spaces and in services and in their contact with institutions. So trauma-informed care, it's really important to extend this to the Jewish community and to understand the particular nature of that. And another thing that was highlighted was the need to combat anti-Semitism. As I just suggested, unfortunately, there's been a big rise in anti-Semitism in the UK, and I would suggest that that's happening across the world globally. This can create fear, as I was suggesting, and that often then therefore creates a barrier to access. And it also is creating a situation where quite a lot of Jewish people are scared. They're not wanting to necessarily disclose their identity, so they might decide to not order, for example, a kosher meal, which is a type of food that is specific to observant Jews, which is offered a lot in UK hospitals, but they might decide they don't want to do that because they don't want to flag up the idea that they're Jewish. So that can affect not just patients and people that we look after, but it can also affect healthcare workers who are also sometimes, feeling they're not psychologically safe with their colleagues. There's been a lot of activism from healthcare workers in this space, and therefore that can create fear also in the workforce situation. So a little introduction, and obviously I'm not a scholar in this matter, but this is just a very basic slide to try and explain a little bit more about the complexity of Jewish identity. So as I said before, we are an ethno-religious group, a very small population, 0.02 of the global population. That's people often overestimate the number of Jewish people that there actually are in the world. 15.7 million approximately, and that number has actually never recovered from the Holocaust. There's still less of the community than there were after the Holocaust, so that has not actually led to recovery in numbers, and we're still a tiny minority. In the UK, where I'm based, we're 0.5% of the population, and Jewish communities tend to concentrate in certain areas. So in the UK, these are the areas I would suggest: London, Manchester, Leeds, big cities, but also Jewish people live throughout the UK, throughout the world. There is pockets of communities, and I myself live in South London, whereas most of the Jewish community that's kind of identified live more in North London. So, there's no hard and fast rules here. As a community, we're very religiously and communally diverse. So as I was saying, there are people who very much are observant with the religious side of their identity. There are also people that identify more as cultural Jews or even secular Jews. And then there are also different types of ethnicities. So the Ashkenazi population, more concentrated in Eastern Europe, Sephardi, Spain and Portugal. That's my identity. Mizrahi are Jews that have lived more recently in the Middle East and also North Africa. And in the UK, the population, we also have 6% are Israeli citizens who have either migrated or are here temporarily. So that's also part of the identity of the Jewish community in the UK. And there will be different sort of types of focus depending on where you are in the world. And also it's important to understand, particularly Mizrahi Jews would also be identified as black or brown, Ashkenazi more adjacent to a white identity. So Jewish culture is very rich. There's a lot of importance on the family. So that's something, that's kind of pertinent to us as midwives working in maternity care. Family is really, really important. Children are really important. There's a lot of sort of spiritual traditions within Judaism. There's a really big importance around food. We have wonderful food traditions coming from all those different places. So Eastern Europe, traditions, and also very much Middle Eastern influence in our food. And, obviously the Hebrew, which is used in our sacred texts. But as I said, there are also Israeli citizens who will be speaking modern Hebrew that might be part of a population that you're looking after. And in the UK, 1 in 5 British Jews are married to non-Jewish spouses. So there's also a lot of mixed heritage families. Myself, I'm married to a non-Jewish man, so we have mixed heritage. So anti-Semitism, there has been a big rise in this, and unfortunately we're seeing it in healthcare spaces as well. It's in all sectors of society. You can see a survey here from the CST, the Community Safety Trust, which is an organisation based in the UK that provides security for Jewish communities. And you can see there's in 2023 to 2024, the last survey, 105% year-on-year increase in anti-Semitic incidents. And I think the impact, this is again coming from that report that I cited at the beginning of the talk, the impact of anti-Semitism and discrimination on Jewish people's well-being, both physical and mental, cannot be understated. These factors must also be understood as crucial and fluid in shaping the community's confidence in trust in accessing healthcare services at any given time. And I think that's why it's really important to have these conversations in these kind of spaces, in these kind of conferences, to raise the issue that Jewish safety is important for us to consider. The Jewish community is a minority community, and it's important for us to understand how we can best provide safe care for them, alongside all the other considerations that we have for many other communities that also have identifiable needs and inequalities. And the other survey you can see on the right-hand side is disturbing, that suggests that 70% of Jewish healthcare professionals that is in the UK have reported an increase in anti-Semitism from colleagues. So we also need to be aware of the impact on our colleagues. We need to be aware that many Jewish colleagues in healthcare spaces, in maternity, are feeling fearful, are feeling that they're not often welcome in spaces. And it's important to safeguard their safety and well-being, as well as the people we look after. And there's evidence really of this kind of uptick in Jew hatred and anti-Semitism. And there's lots of evidence that's been looked at by journalists. These are all from mostly UK press. But you can see a woman here interviewed saying, "I'm so scared of giving birth in a UK hospital. I've hired a Jewish doula." So we're seeing this quite a lot within the Jewish community, that women are feeling unsafe when they're coming into maternity services. They're not sure if they will experience discrimination or inequitable care. And they're often bringing a Jewish doula, a birth attendant, a birth supporter with them in order to feel more safe. So I think that's something that we should be concerned to hear about. There's also a suggestion that medical regulators have not been protecting Jewish patients and NHS staff by not being able to understand or identify when there is anti-Semitic behaviour by Jewish or towards Jewish healthcare workers or patients, not understanding that this is an important breach of professional codes and conduct, as it would be with any other type of racism. And in the UK at the moment, there is actually a major report being undertaken into how to better tackle anti-Semitism and other forms of racism in the NHS. And hopefully there will be some recommendations coming out from that review, which will be really helpful across the board. So this is not a major talk about anti-Semitism, but I think because I'm obviously touching on it in various ways, I think it's important to try and look a little bit at some of the common anti-Semitic tropes, so that perhaps you will be able to better recognize them, understand where they're coming from, the roots of them, and also, call them out. Hopefully, if you see anyone, doing behaviour that's unprofessional and breaches our codes of conduct. So one of the key ones, which I think has actually been unfortunately quite distressing for a lot of Jewish people within the birth world and within healthcare, is blood libel. So blood libel is an historical anti-Semitic trope, which was actually started in the UK around 1194, medieval times in Norwich, a big city in the UK. And the Jewish community was accused of killing a child it was actually a Christian child, and using blood in religious rituals and ceremonies. This is actually completely contrary to Jewish law and obviously a grievous lie. But unfortunately, this lie, blood libel, has been repeated and has been used and has been weaponized against the Jewish community since then throughout thousands of years, and has often triggered pogroms and mass expulsions and lots of violence towards the Jewish community. In contemporary forms, you might be familiar, unfortunately, with the way that blood is often used in protests, particularly against conflicts in the Middle East and Israel. And often the term such as baby killer is used and weaponized against Israel and against Jewish people. So you can see the kind of root of blood libel all the way back thousands of years, and how it's so embedded in our culture, it's so embedded in societies that it's kind of often, appears again in different contemporary forms, and again is very distressing for Jewish communities, and is obviously a key kind of anti-Semitic trope. Other tropes that again might have echoes from the past is this idea of Jewish power and wealth, and that therefore by sort of punching up, there is no case for us to consider anti-Semitism or racism against Jewish people because Jews have power and wealth, and therefore they are not a minority that should be considered as vulnerable or in need of any particular support or understanding. Within that, there is a sort of inverse idea about Jewish people, which is that also they are kind of lowly. They're often related to, dirty, or they're related to vermin or snakes, or they're seen as demons. So there's a kind of inverse to that idea of Jews being powerful, is that also they are a kind of base and, kind of vermin. So there's this kind of very weird kind of dichotomy that goes on. Another anti-Semitic trope is this idea of dual loyalty. So it's the idea that Jews are always a kind of a community within a host country, within another society, and that they have more loyalty to their own community or maybe to Israel in contemporary times than they do to the host country or host society. And so they are seen as insidious and disruptive, and that you can't trust them. So that idea of dual loyalty. And another issue that's often seen, and particularly at the moment, is Holocaust denial and inversion. So the Holocaust is not seen as, it's denied that it happened, and there's also kind of inversion. So the Jewish community is accused of being like the Nazis, or creating another Holocaust or another genocide. So that's another form of kind of key anti-Semitic trope. Yeah. Okay. So what I'd really like to go on to talk about, having outlined, what are perhaps some of the more sort of disturbing aspects of this subject and this topic, is how we can best support Jewish women and people who birth and families as midwives, as educators. And so I just wanted to raise some of the key kind of issues that might be in play when you're looking after these families. So this would be, some of these issues relate more to Jews who are really observant. They have a religious observance, but they also can be key cultural issues that are important for Jews who don't necessarily visually identify or are identifiable as being Jewish. So one of them is this idea of family purity laws. So within an observant community, there are several issues around purity, around women's bleeding, around giving birth, that might determine, for example, when a man is allowed into a birthing space, when men might touch women. So there are those kind of issues that would come into play with observant Jewish people. Another aligned to this is the idea of privacy and modesty. You might find, if you're looking after observant Jewish woman, that that's important for her. And so it's particularly important if you are the midwife, for example, that you are aware of that and you take special care to protect her dignity. There are various dietary laws. I was talking about kosher foods. So you'll find a lot of hospitals in the UK do provide kosher foods. Other Jewish people, they might want to bring in their own food because they're not sure if that will, be correct, and they would prefer to bring their own food in. That's the same with many other communities. So there are various dietary laws that might be an issue. Jewish people hold Shabbat, so our religious laws are around a day of rest from Friday night till Saturday night. So a lot of Jewish people will observe that. So they might have an important family meal, for example, on Friday night. They might attend synagogue on Saturday morning. But very strictly observant Jews may also have other restrictions on their activities. So they are not going to work, and that can extend to them not being able to attend appointments unless it's a life or death situation, or they may not want to use electronic devices, so they may not get messages from hospitals about appointments. They may not want to turn on lights on and off. They won't prepare food. And this can also have some impact on lactating women. So when they're pumping milk, if they're pumping, and that when they're preparing formula. So there are various issues around Shabbat and many other religious holidays as well. There's quite a packed program of religious holidays in the Jewish calendar. So you'll find that at other times, Jewish women might be not taking food, they might be fasting, or they might again not be working or want to attend synagogue. So there are quite a lot of issues around the Jewish calendar around Shabbat and holidays. So something you might be aware of is that male children are circumcised on the seventh day after birth. This is called the Brit Milah, and this will be done hopefully by a trained healthcare provider, but there's often ceremony around it. So it's a very important practice. So you'll find that probably most Jews, whether they are religiously observant or not, will want to observe this practice. And there are also certain issues around mourning and burial. So if you are unfortunately involved, for example, with a stillbirth or miscarriage, there are quite a lot of issues around that. Jewish communities, they do quite quick burials within 24 hours. So that might impact, for example, and that might cause some distress for people if they were not able to do that, either for a mother, if that was the case, or for a child. So again, sensitivity around those issues. Also within healthcare, there are some wider issues, which is that there are a higher number of certain types of genetic diseases in the Jewish community, particularly in the Ashkenazi community. So these are certain autoimmune diseases such as Tay-Sachs. There is also a slightly higher risk of breast cancer. So there are some issues within genetic screening that a Jewish family might want to get tested for things that you wouldn't ordinarily see in other communities. There's also been, and we noticed this in COVID, certain amount of hesitation within more observant communities around vaccination. So there's some vaccination hesitancy. So that will be important in a public health context to make sure education, leaflets and information was, very well circulated within those communities. There also might be some issues around assisted reproductive technologies if people are using that. Some people actually would not want to use a Jewish donor, or they might want a Jewish donor because, again, of the risks of passing on any inherited conditions, etc., or the risk of not knowing who was providing that. So there are some issues there that would be interesting to kind of make sure you had some awareness of and provide the best care. Breastfeeding traditionally is viewed in a very positive way in the Jewish community. In the Talmud, or some of our Jewish sacred texts, it's suggested that spirituality is actually related from the mother to the child through breastfeeding. It's seen as a spiritual practice, and there's often the desire to breastfeed for up to 2 years. Again, WHO recommendations. So that's aligned, which is nice. So breastfeeding could cause issues if people are not able to breastfeed or they're having any breastfeeding issues. That could be particularly distressing for some Jewish people. Also, again, as I raised, that the Jewish community is very diverse. So there might well be mixed heritage couples and LGBT couples. So to understand, excuse me, that the Jewish community is diverse. Excuse me, first thing in the morning here in London. So because of the rising levels of anti-Semitism, I wanted to talk to you about a very positive initiative that's been created here in the UK with myself and various other wonderful Jewish birth workers across the formal and the informal sector, so doulas, academics, lactation consultants. We have co-founded a new organisation called Shifrah UK. Our mission being to celebrate Jewish birth and advocate for Jewish families and birth professionals. So this is a platform, and you can find us online. We have a website where hopefully you can come and you can gain more information about the Jewish community to help you, inform you in your quest, hopefully, to provide safe, culturally safe care for the Jewish community, as you will do for any other community. So we also provide training sessions. So there's a form there if you wanted to book any training sessions for your colleagues, for your educational institutions. And we also have a birth directory so that we put Jewish families in touch with Jewish birth workers. So we have a directory of independent midwives, doulas, lactation consultants, and actually, yoga instructors, all sorts of different types of practitioners, which goes back to what I was saying earlier about some of the fears from Jewish women in the UK around whether they will get fair and equitable care in the NHS or from other birth workers. And so people wanting to actually connect with safe Jewish practitioners. So that's what our birth directory is doing. We also have lots of blogs and articles, so it's a place for learning more about our community. And we also signpost to lots of other Jewish organisations that can provide, training and support to Jewish families. So we provide a network to lots of other organisations for you to do further research and learning. We also are starting to put on events. So we have coming up, there's the first time in the UK, we have Jewish Culture Month, starts in about a week, and it's for a month. And we will be presenting an event as part of this. You can see on the right, Jewish Birth and Life Cycles event, where we're having various birth workers talking about their practice. We've got a wonderful BJ Woodstein, who's created a book, which is all about Jewish birth practices. So she'll be talking about that. We've got a wonderful Rabbi Miriam, who's starting a new organization called Wellspring, which is using this traditional practice of mikveh, which is a form of going into water, into a type of pool to purify you after menstruation, after birth, and at key other life events. She's creating a kind of contemporary form of that as a center where we can honor kind of different life events. So she'll be talking about her practice. We've got singing. So this is a very open event to everyone in the Jewish community and beyond. So that's something you can find out about, again, particularly on our Instagram. And then on the left-hand side, we're starting a series of birth preparation classes for Jewish families. And this will cover all of the aspects of birth preparation that you would expect in a course such as this, but also we'll be talking about various cultural and spiritual practices along the way to try and kind of support Jewish families that want to include those practices in their birth and parenting journey. So myself and other colleagues, we go and do quite a lot of training now in educational context. So we've talked quite a lot to midwifery organizations that are, supporting student midwives or continuing professional practice for midwives and birth workers. And what we often do in this scenario is we create some scenarios for people to think through. And we do this in an interactive way. So I'm not sure we can fully do that in this session, though we can obviously come back to it with any questions that might arise at the end. But just to give you an idea, because hopefully it'll start to spark in you some of these questions or some of these issues that you can actually apply directly in practice. So let's just talk through this one. So Shoshana and Yoatan are a religiously observant Sephardi and Mizrahi Jewish couple expecting their third baby. You take over Shoshana's care on the birth center on the night shift. Tonight is Friday. Shoshana has had a straightforward pregnancy and considered obstetrically low risk. What considerations might be relevant to Shoshana and Yoatan's care? So you could put something in the chat if you wanted to, but if I just sort of talk through this a little bit, because it's a more kind of conference presentation style this morning. So going back to what I was saying about Shabbat, so we have a tradition in Jewish culture that Shabbat is sacred, and people often will not work. They will not operate any machinery or any devices, or use, electrical devices during this time. And it's very much a day of reflection and rest. However, over and above that, if there is any kind of risk to life, all of that goes to the side. So basically, you might well be looking after a religiously observant couple during Shabbat, and all of those kind of conventions while we're undertaking birth care will be to the side. But leading up to that, and perhaps after the birth, there might be considerations in terms of how you are contacting wider family who might not pick up devices. The couple themselves may not want to operate their own devices, or, as I say, turn lights on and off. It will be important to understand that this is during the Shabbat time. So that's one scenario where there's quite a lot of flexibility around the conventions and rules, but nevertheless, they are still there in the background. So let's look at this next one. So Lily and Mim are a lesbian interfaith couple who have just welcomed their first baby, a boy. Miriam maintains a deep connection to her Jewish traditions and cultural practices. In Judaism, these traditions extend beyond religion. They encompass a rich tapestry of customs and values passed down through generations. Lily and Mim are planning a Brit Milah, or sometimes called a bris, traditional circumcision for their baby on day 8. You meet Lily and Mim at home on postnatal day 5. You note jaundice while assessing the baby. His weight loss is minimal, and your holistic assessment reassures you that he is clinically well. How might you sensitively explore Lily and Mim's plans for circumcision? So, given this tradition, they might well have planned to have an event. They might have it at home, and they will bring in a practitioner who will do the circumcision, which will not just be a medical procedure. It will be also circled around with very spiritual practices, and often, members of the community will be invited. There will be, a celebration after the event. This happens generally with the men on their own, and the woman is separate and will need to be supported by family members and friends. However, you'll note in this scenario there's some jaundice suggested on the baby. So the Brit Milah, even though it's traditionally done on day 8, if the baby is unwell, it would not be considered to be appropriate, and that might well be delayed. So that's another issue for you to sort of understand, that you might be looking after a baby that's had a circumcision. You might be looking after a family before that ceremony, and they're getting ready for it, and it will be a really important element for them in those early weeks. Nevertheless, you might also need to provide some clinical judgment and have a discussion with that couple about whether it's appropriate if the baby is not well. And this could extend also if a baby, for example, was in the neonatal unit, was born premature, and it was not considered the appropriate time. So just to do a summary of what we've covered in this session, so to highlight the fact that Jewish communities have often been neglected and overlooked regarding health inequality, and that's something that, at Shifrah UK, we're really trying to address in the UK, and we're actually having very good engagement at the moment with bodies within the maternity sector. So the Nursing and Midwifery Council, our regulator here in the UK, have invited us onto key groups, and we're working with them to include the language of Jewish cultural safety into the wider anti-racism and EDI work that's going on. As also the Royal College of Midwives, we've had very good engagement with them and spoken recently at their education and research conference. So as that report, the Race and Health Observatory report, highlighted, it's really important that we increase the amount of education and understanding about the Jewish community. It's essential for improving access to services for our community, and for healthcare workers to be well equipped to deal with this community whenever they're looking after them as individuals. I've tried to explain how anti-Semitism functions in a slightly different way to other forms of racism. There are key tropes which have, been embedded in societies, and you can see them kind of manifesting in different ways over the centuries, and we need to be able to identify and understand them. I made the point about how diverse Jewish communities are, and that there are various other intersecting identities around, ethnicity, race, and observance. And so that's something that's important for us to identify here in this talk, and you as healthcare professionals to understand. And that there are many cultural, religious, and public health issues to consider when caring for Jewish women and birthing people. So we hope that Shifrah UK will be a useful and important resource for you. Please do share it with your colleagues. There's a QR code there, will take you straight to the website, and the web address there is shifrauk.org. You can also follow us on Instagram at Shifrah UK, where we post regularly information about different cultural festivals that are coming up. We highlight, when we're going to be talking at conferences or when we've got a new blog on our website. So it's a good resource as well to follow us and to support us. And I'm really, really happy to answer any questions from anyone in the audience now. So thank you so much.
Thank you, Laura. I think that was really insightful. And my initial question is, how do we get more education into our universities and midwifery training courses? Because just listening to you there, I realised my gap in knowledge, and the lack of cultural diversity in education, I think. And I know they're trying to move to more culturally diverse education, but I still think this is very much lacking. What's your experience of the
Yeah.
education sector?
Right. Yes, I totally agree with you. And that's why it's really good that we're working currently with the NMC, because we're trying to embed this understanding within the regulator, the information they're sending out, and within educational contexts, so that when we're doing work within about anti-racism, when we're doing EDI work, we are also considering the Jewish community as part of that. So I think that it's really important to raise awareness about this subject. That's what I'm trying to do in this talk, and for that to filter through educationally and also into mandatory training for professional midwives. So that again, when professional midwives are doing mandatory training around EDI issues, there is, an understanding that the Jewish community also needs to be considered as part of that work.
Mm. We've
I'm
got a
not going to
question.
answer the question
Oh,
about Palestinian maternity care because that's not what this talk is about, but thank you.
is there any other questions from anyone for Laura? We don't have much time, because we need to close up in the next 5 minutes or so for the following sessions. But I'm sure either Laura or Shifra UK will field any questions through email as well if anything comes up after the session. Diane says the website's a great idea, very useful. Midwives cannot be experts in every culture, so it is important. Yeah, I guess that signposting's really key so that people in healthcare professions have got somewhere that they can go and explore if they come across families that they're working with
Yeah,
different.
I mean that's what we're hoping with the website is that we're a resource, so that we're hopefully raising awareness about this issue so that the issue is being taken seriously by our educators, by our regulators, by our union, by our institutions and trusts, hospital trusts. But also we're hopefully providing a resource where people can come and find out more. We're trying to make it really easy for people to, increase their learning and understanding about us as a minority community.
Thank you, and thank you for all the work that you're doing to raise awareness as well, so that we can as professionals support Jewish women and Jewish families in their maternity journey.
Thank you.